Welcome to Bullet Point Nursing. My name is Dr. Goldstein. Let's get started. Today we are talking about the SBAR, and the SBAR is used in multiple formats. The one we're going to be talking about is specifically what it is originally intended for, which is as the format to give a report from a nurse to a provider when they need a specific order or to inform the provider of a specific situation. The SBAR format has been adapted to be used for many other types of reporting that we are not going to discuss here. So the SBAR is used to deliver clear and concise information from a nurse to a provider relating to an issue that needs their attention. This could be because they need an order for something, such as a medication or a CT test, or it can be because they need to notify the provider that their patient has developed a fever or severe pain or any other change in their condition. So what does the SBAR stand for? It stands for situation, background, assessment, and recommendation. So let's begin with the situation. When you as a nurse call a provider, you need to begin with the following components: your name, the facility you are calling from, the patient you are calling about, their age and gender, their admitting diagnosis, how long they have been there. So this says LOS, which is length of stay, or POD, which is post-op day. And one is used in a surgical patient, one is used in a medical patient. And then the last part of the situation is a one sentence about the problem. So for example, a call would go, this is Josh at ABC Hospital. I'm calling in regards to Jane Smith, a 67-year-old female that is 1 day post-op for a total knee replacement. She is now complaining of discomfort to the right leg. Keep in mind, as a nurse, when you're calling the provider, they may be taking calls from multiple facilities, and different facilities may have different protocols for what they can order and different abilities for what they can do. So you need to be sure to include the facility. You want to include the admitting diagnosis to give the provider some sort of context for what you're about to tell them. There's a big difference between discomfort to the leg when a patient is post-op total knee replacement versus if they're in there for pneumonia or migraines. Let's move on to background. What is the background of the patient's stay or condition relating to this specific concern? So for example, related issues since their admission or since their surgery. And this is usually a very brief sentence. So for example, she has not had any complications since surgery other than mild incisional pain, which was controlled with acetaminophen. So if there was something else here, for example, if the patient developed a post-op infection or gangrene of the surgical site or something like that, that would be included in the background. In assessment, you're going to put your related assessment to the issue at hand. And this can include whatever is related. It can be vitals, it can be lung sounds, it can be a focused exam, such as a pain assessment or OPQ-RST. It can be their mental status or a skin assessment or any other type of assessment. So in this case, for our example to continue, she has no change in vital signs or mental status. She does have 2+ pitting edema to the affected extremity distal to the knee. This was not present on shift change exam this morning. And that's an important point to make so that the provider knows there's been a change in condition. Her pulse, motor, and sensation are intact throughout the extremity. Capillary refill is less than 3 seconds. Her leg is slightly warmer to the touch compared to her other leg. This is important information to give to the provider without them having to prompt you and ask for it. The patient reports pain upon palpation of the leg, no redness, cyanosis, or other issues noted. At this point, the provider may have additional questions, or you may have given them all the information they need for them to go on to develop their next step. In the recommendation section, you may give a suggestion to the provider. So for example, in this case, it could be, would you like me to examine the patient further? Would you like to examine the patient? Would you like to order an ultrasound or any specific medication? In general, your recommendations are usually going to be for the provider to come and make an assessment of the patient themselves, for them to order some sort of exam, or for them to order some treatment. You do not have to provide a recommendation. You can say, what would you like me to do? Or is there any order you have for me at this time? You may also be calling just to notify the provider that there's been a change and it's completely on them what they would like to do. For example, if the patient is post-op and develops a fever, the provider may just want to be aware of it and take an appropriate course of action that they determine. Finally, some key points. When you are calling the provider, be prepared, have your SBAR already planned out, be ready to answer any questions, have more information than what I just gave you, be ready for anything. Always start with the key points mentioned above. Don't start with patient's vomiting, what do you want me to do? Because they don't have context yet. Is this a patient that's pregnant and has been vomiting for 6 weeks? Or is this a patient that is intubated and now that they're vomiting, they're at risk of aspiration? Finally, be ready to write down any orders that the provider may give you, as always. And depending on the facility, the provider may be entering the order in their EMR, or they may be expecting you to take it. As you should already be aware, anytime you're writing down a provider's order, make sure you always read it back. Thank you for watching. Have a great day.